At 10 weeks of pregnancy, your baby is rapidly growing and you might start noticing some signs and symptoms as your body changes or adapt to the changes. So here are what you can expect. If this is your first time of seeing this page, don't forget to subscribe. Baby's development. The baby is about the size of a strawberry, about 3 centimeters long. The baby's facial features are becoming more defined with the ears, nose, and the lips forming. Tiny nails are beginning to develop on the fingers and on the toes. Then the next one is movement. The baby is starting to make small movements, although you won't be able to feel them yet. Heartbeat. The baby's heartbeat is fully formed and the beat is around 180 beats per minute. So, this is what you should expect around 10 weeks of pregnancy. Then the symptoms you might experience. You might start to experience fatigue, that is increased tiredness due to hormonal changes, and your body is working harder to support the pregnancy. Morning sickness, more severe nausea and vomiting may be present, although it might start to decrease as you approach the second trimester. The next one is bloating and gas. Hormonal changes, particularly increased estrogen, can slow down your digestive system, leading to bloating and gas. So once you see this sign, it might even you might even think that is your baby bump coming up, but it's bloating. The next one is constipation. Due to the slowing of your digestion, constipation can be an issue. So, what do? You start staying hydrated, drinking enough water, and consuming high fiber foods can help you overcome this constipation. The next one is heartburn and indigestion. The uterus that is growing and the hormonal changes can cause acid reflux and indigestion. So, this is as a result of hormone and the baby and the expansion of your uterus and abdominal wall can lead to reflux and it can be painful. Increased sense of smell. You may notice heightened sensitivity to smells, which can trigger nausea or food aversions. You are more likely sensitive to smell around your environment, which can cause nausea most times. The next one is food craving and aversions. You might start to crave certain foods or develop aversions to foods you previously enjoy. You might see yourself taking weird foods that you might not take as your normal self and even stop the ones you like. Headaches. Some women experience more frequent headache due to hormonal changes and increased blood volume. Skin changes. You might notice changes in your skin such as increased oiliness, prone to acne, or a pregnancy glow due to increased blood flow. The next one is breast changes. Your breasts will become fuller, tender, heavier as they prepare for breastfeeding. The growing of the uterus is now pressing on the bladder, causing you to urinate more often. That is what causes frequent urination in early pregnancy. The next one is mood swings. Hormonal fluctuations can lead to emotional high and lows. So, most times you experience mood swings in early pregnancy. Increased vaginal discharge is also present. The next one is visible vein. You might start seeing visible veins, especially on the breast and on the abdomen, due to more blood volume that is going to such areas, that is going to the uterus. You might, as the uterus expands, more blood vessel will begin to show. What to expect at this time? What should you do? You should have started your first prenatal appointment. So you should expect your first prenatal appointment around this time to confirm the pregnancy, and they might perform ultrasound to check the baby is developing very well. Weight gain. You might start to experience increase in weight, although it varies from person to person. Some people might not add weight while on early side of pregnancy. Dietary adjustment. You may need to adjust your diet, include more folic acid, iron, and calcium to your diet. So it is important to know your body and to rest when needed. If you have any concern or an unusual symptoms that is not mentioned here, such as bleeding, excessive cramping, you should let your healthcare provider or your doctor to know about it. See you in my next video. Bye.